All right, it says 12:30 at the back of the room. So, welcome to our Research Education Seminar Program for 2026. My name is David Cullingford and I'm the new Research Education Program Fellow for Perth Children's Hospital and the Perth Children's Hospital Foundation. We'll start with an acknowledgement to country. So, the Child and Adolescent Health Service acknowledges the Whadjuk and Binjurrum people of the Noongar Nation. Sorry, we've got a little bit of... All good? Yeah, beautiful. Of the Noongar Nation as the traditional custodians of the land, sea and waters on which we work and live. We pay our respects to the elders past and present. CAHS is committed to working towards a better future where all cultures are respected and valued and Aboriginal people take their rightful place as the first Australians. So I'm introducing the program today and then I'll introduce Professor Kenneth Lee as well. For those who haven't attended before, we run this program throughout the year. It's usually about 1 hour presentations across 25 different topics relating to research. All the seminars are recorded and available on our website. You can also look at previous year's seminars as well, because some of them are repeated, but some of them are new topics, and so that means there's some old topics that won't be covered this year. There's a link to the handout as well that you get if you register, so you can look through some of the paperwork as well to remind yourself at a later date. And then there's an online evaluation form that'll be sent via email if you did register, and otherwise there'll be a QR code at the end to follow that as well. People online, feel free to ask questions at any point, but they'll get brought to the floor at the end of the presentation. And if you're here, if we can just leave the questions to the end, so just write them down on your phone or a piece of paper or something. So this is Associate Professor Kenneth Lee. He is a senior lecturer and clinician, and in his clinical practice he works in a large medical centre as the in-house pharmacist as well as in private consultancy, where he primarily delivers comprehensive medication management review services to patients residing in their home. Dr. Lee is passionate about integrating practice, research and teaching. I hope you'll all make him welcome. Thank you.
Hi everyone. Thanks for making the time to give up your lunch hour to learn. So hopefully this will be extremely educational for all of you. I guess my goal for the end of today or the end of this session is for you to walk away feeling confident that research isn't that hard. It's not easy, but hopefully you walk away feeling like you can do it. So there are 3 key things I want to talk about today. We'll start off with why research. It might sound a little bit nebulous, but it is an important consideration. I'll walk through the 8 steps of the research lifecycle, or what I've dubbed as the 8 steps, and give you some practical tips as well. So why research? For me personally, research is about 3 things. It's about creating new knowledge, so not reinventing the wheel, actually finding something that is new and that is trustworthy. To share that knowledge, because there's no use in keeping that sort of internally. Generally, other people would benefit from that knowledge, so being able to share that, and to really have that knowledge to help people either directly or indirectly. Everyone's why is different. It may be that you need to tick a box to do some research as part of your training. It may be that you need it for promotion, but hopefully that shouldn't be the only why for you. And even if it is, also think about, well, beyond ticking a box, if tick boxing is one of the requirements, who do you actually want to benefit from the work that you're doing? And also, who is your audience? So knowing why you're doing something gives you a bit of focus, so that when you're writing a paper, you're not just thinking, okay, I just need to summarise everything and just send it off and then done, next paper. It's about thinking about, well, how can I write this so that people that read it can understand it and that can share it with other people? Who do I need to share it with? It might be that you need to share it with a broad range of audiences. It might be that you have to share it with clinicians and researchers, but also you want it to impact patients. So in terms of how do you get the word out there, clinicians, researchers, that's easy. That's a very distinct, defined path. Is sharing it through, conferences, sharing it through publications, but then also thinking about, well, if I want patients to benefit from it, maybe thinking about doing a plain language summary and sharing that with local communities, with consumer groups. So spend a bit of time thinking about what your why is, because that's really going to give you a bit of focus when you're doing your research. All right, so quick overview of what the 8 steps are. Firstly, identify the problem. It's a lot harder than it sounds, but I'll give you some tools to help make it a little bit easier. Learn about the problem's context. Know where the problem is situated. So it could be, for example, that you might think that there's a lack of research around a certain drug that's on the market and whether it works for younger people because it's only been tested on adults. Looking at more broadly, why is that problem? Why is that problem a problem? Why do we care about a younger audience? Designing the actual study, which I'll spend quite a bit of time on. Planning the project. Now, a research project is 2 things. It's research and it's project management. So I've tried to split the 2 just so that you don't forget that it's beyond just doing the actual research. It's making sure that it actually gets done practically from a project management perspective. Doing the actual work, evaluating the work, summarising and sharing. I'll run through these in more detail. So in terms of identifying the problem, if you're not able to articulate the problem in detail, then here are some tools that you could consider. So I'm sure everyone's aware of PICO. You've heard of PICO, Population Intervention Comparator Outcome. That's typically used in quantitative research, usually for experimental studies, so testing drug A versus drug B on mortality reduction or something like that. If your topic is a little bit more social, administrative, or the social sciences around people's experiences about a service, then PICO with the lower case O is another tool you could consider. Population, interest, context. And I'll give you some examples. So the big all caps PICO might be a little bit easier for you. So it could be what is the effect of novel drug A on mortality reduction compared to standard drug B amongst children aged 6 to 12 with a particular condition. So population, intervention, comparator outcome. Some examples from some of my previous works when it comes to more the social side of things. What is the level of satisfaction of patients who receive wound care consultations for their acute wounds from a pharmacy-based wound clinic? Hopefully I got my colours right. Yep. So, they look a little bit different on here, but anyway. So what I'm interested in is the level of satisfaction. The context is pharmacy-based wound clinics, and the population are patients that receive wound consultations for their acute wounds. I'll give you another example. What types of information do Australian consultant pharmacists receive on home medicine review referrals? So the context is home medicine reviews or referrals. The type of information is what I'm interested in. So, whether they've got patient demographics, whether they've got laboratory tests, whether they've got medication lists, etc. And then the population of interest is Australian consultant pharmacists. So whenever you're unclear of what the problem is, or you kind of know, roughly this is the ballpark, having these sort of tools can help you narrow it down a little bit more further so that you've got a bit more clarity in your mind. So frame the problem as a useful, answerable question, and then that's going to be your research question. So that's step 1. Once you're able to articulate the problem, then it's about doing a bit more background research to make sure that it is actually a problem, that you're not just reinventing the wheel. Even if you're sure, always do a check because you don't want to run the risk of spending months or years to do research only for it to have been published already and you've just wasted all that time. So do a read through the literature, a CAHS Research. For those of you that want to do research in doing systematic reviews or scoping reviews, that's much more than a CAHS Research, but any other type of research, you're really just doing a bit of a CAHS research to make sure it hasn't been done and to find out more about the broader context so that you can then have a much more defined research project. So in terms of how you do a CAHS research, yes, a librarian or other researchers might tell you to use certain databases. Yes, they're great, but starting out, something like Google Scholar is a good start. Something like PubMed on its own is a good start. So Google Scholar is going to give you lots and lots of results. Quite a lot of it would also be irrelevant. PubMed is a little bit more defined. So PubMed basically is a database that collects a lot of biomedical journals, which contain biomedical research articles. But, for example, if you were in allied health, some of allied health research may not be captured by PubMed, so, and that would be captured by Google Scholar. So depending on your field, Google Scholar may be a good start, otherwise something like PubMed. If you're more adventurous and you want to use AI tools or kind of more advanced tools, something like Jane, which I'll talk about on the next slide, Connected Papers and Research Rabbit, they're good places to start just to get a little bit of a handle on the research problem. So this is Jane, meet Jane. If you Google Jane biosemantics or look at the URL at the bottom, you'll be able to access Jane. Jane is an awesome little tool. It's been around for almost, I think, 20 years. So it's a very early AI, but still really, really useful. And it's a way that you can find related articles, find authors that publish similar works, or find suitable journals to publish in. So you can use it for 3 different reasons. In the context of doing your CAHS research, I would use it to find articles. So you'd start off with one article that you're really interested in or that's relevant to your research problem, and you can type it in, you can do the title, or you can include the abstract, and you can click the Find Articles button, and it'll give you what it thinks are relevant articles to go to. And that saves you time trawling through hundreds of pages of Google Scholar or PubMed. If you've got good skills in developing a search strategy, that's going to be a lot more effective. But if you're starting out in research, this is a good tool to consider. Another one is Connected Papers. So both Connected Papers and Research Rabbit, which is on the next slide, do come in free versions as well as paid version. Obviously, start with the free and see how you go. And if you like it, then consider paying for it. But Connected Papers is a way of finding relevant papers, and the way it does it isn't really with AI, it's really looking at citations. So for example, looking at my 2023 paper in black, these are the papers that I think from memory cite, oh no, it's a different paper. But yeah, basically it looks at papers that cite my work and also papers that my work cited. To give you a network of potentially relevant papers. Research Rabbit works pretty much the same, but it gives you a bit more customizability, and you can put in more than one paper. So Connected Papers, you put in one paper, and it gives you all the related papers, backward and forward citation. Research Rabbit, you put in multiple papers. They recommend at least 2, and it will look at similar works, earlier works, and later works. So it's just a good way to get your head around relevant papers and to familiarise yourself with the research problem and the context. All right, so once you've really figured out whether the research problem is a real problem, whether it's been done before or hasn't been done before, then it's about kind of doing some broader reading, and you can use the same tools to do some broader reading. If you are doing a formal literature review that you intend to publish, like a systematic review or a scoping review, there are software that you could consider to save you a whole lot of time. I've just listed a couple as Research Screener. Covenants, I wouldn't say saves you time, but it helps you organise your search and allows you to do independent searching so that you've got multiple people searching independently and then coming together to consolidate any sort of disagreements between searchers. And then there's another one called Terra Tools, TERA-TOOLS. If you Google Terra Tools, that will save you time with screening research papers if that's what you're doing. There will be a talk soon on systematic reviews given by another presenter, so yeah, you'll get more information about that later. Not necessarily the tools, but about the actual systematic review process. So learning about the broader context can help you further refine your research question. It can help you identify where there are clear gaps and where there are areas that are well researched, and you can further narrow down your research question. So once you've got a relatively refined research question, it's about thinking about defining your aims and objectives. Now, I don't want to give a whole lecture on defining your aims and objectives, but just as a very quick summary, the aim is kind of your overall purpose, and objectives is how you actually do it. So it could be, as an example, you might be running a weight management clinic. Random example out there, and you wanted to find out what people thought about the clinic and whether it worked. So the objectives could be around actually looking at any changes in baseline weight, could be changes in waist circumference, it could be clients' level of satisfaction, sustainability, post 12 weeks. Those would be your specific objectives. Underpinning all of this could be your broader aim of looking at the success of the particular clinic. So just as a very kind of wild example, aims are broader, objectives are much more narrow. More often than not, I typically start with objectives and then go broader to see what the bigger picture is. And then I start with the objectives, define them, then define the aims, and then re-look at the objectives to make sure everything's nicely aligned. Number two, really important step is around selecting your study design. And there's this really important reason for selecting the study design, because once you know the specific name, there's lots and lots of articles that you can look up that tells you what the pros and cons of that particular study design is. There's guidance on how to write a paper that uses that particular study design. So step two is really important, and I've got a few more slides later on that will kind of go through that. But very broadly, is it experimental or is it observational? Are you doing something to someone or some group of people, whether it be providing education, giving them a new drug, surgical intervention, etc.? Are you doing some sort of experiment that you wouldn't otherwise do? Or are you just collecting feedback, observing, progress? So that helps you sort of decide whether it's experimental or observational, and then there's further study designs within that, which I'll go through. Once you've selected your study design, think about who your participants actually are. So not just, kids, what age, what condition, what conditions should they not have, your exclusion criteria, and think about how you're going to recruit them. Then think about how you're actually going to collect the data. So it could be that you're running an experiment, you're testing a new drug on a group of people. Well, how are you going to check whether that drug works? Are you looking at lab tests? Are you doing biometrics? Are you asking people questions? That will dictate how you collect your data. And then that will also dictate how you analyse your data. And finally, but last but not least, ethics. There's the application and there's the approach. So because of the paperwork that we do in most of our jobs, it just becomes almost like another tick box. But there's a difference between getting the ethics application approved and making sure that when you're actually doing the research, you continue to be ethical in your approach. There is obviously overlap. Ethics applications are designed to help people think more critically about potential harm and public safety. But just remember that even though you might have your ethics application approved to do a particular research project, and that the ethics committee missed certain things, that you still continue to consider how do you make sure that whatever you're doing is ethical and that you're handling people's data appropriately. I get feedback every year that this is really small. I apologise. I made this not thinking that I would be giving a talk about this. This was for my students initially. I have included a slightly larger version in the handouts, so if you've got the handouts, you'll get a slightly bigger version for those of you that are struggling to see. Yes, I know it is a bit small. But this is just a very quick brain dump that over the years I've tried to consolidate my understanding of different types of research study designs. Different textbooks will have slightly different distinctions, but just to really give you a very simplified way of seeing study design. So thinking about, are you collecting quantitative data or qualitative data or a bit of both? You know, if it's quantitative data, are you doing some sort of experiment? So is it quasi-experimental or experimental? Or are you doing some sort of observational study? And then from there, it breaks down into specific study designs. And that just gives you an idea of, okay, what is it that I'm trying to do? Once you've figured out the study design, then it's about finding a suitable reporting guideline. Now, a lot of people do the reporting guideline at the very end, and that's what it's meant for. It's meant to help you with transparent reporting. But if you haven't considered it from the start, you might not have the data to report or the information to report at the end. So always start with the end in mind. So there's a website or an organisation called Equator Network, and basically they collate all quality reporting guidelines. So like I said, a reporting guideline teaches you how to transparently report a particular type of study, but also use it as a bare minimum standard of what sort of things to think about when designing a study. So this is what the Equator Network looks like. Step one, figure out what study design it is, because it won't help you. Once you know what study design it is, then it's about selecting the relevant study design and then selecting the relevant reporting guidelines. So it might be that you're doing a protocol about study protocols. A bit meta, but it's a thing. And SPIRIT is the reporting guideline for study protocols. Why is it useful? Well, it gives you a checklist of everything that, of the bare minimum things to report in the write-up, but also they're useful for helping you consider what to actually think about. Now, these checklists are fairly brief. You might not know, for example, what a primary, secondary, and other outcome is. Thankfully, on the Equator Network, not only do they have the checklist, they often have something called an explanation or elaboration paper. And basically, it's one or more published papers where they go through the checklist, they tell you what it means, and they give you some written examples or excerpts about how to write it. So if you've never written a paper before, this is going to be a really awesome resource for lots and lots of different types of standard study designs. For those of you that work in WA Health, which probably will be all of you here, if your research is conducted within WA Health and you're accessing data, or you're accessing data from WA Health participants, including their tissue or data, then you'll need to complete the relevant research protocol template, which is on the RGS website. So they've got specific protocols and specific templates that you need to fill in. It doesn't mean that what I said on the previous slide is irrelevant. Use that as the initial starting point to make sure that whatever you're doing is robust. Plonk it into the research protocol template. And another thing to consider, if your research involves statistical analysis, which for most of you would do if there's any sort of quantitative data, also consider developing a statistical analysis plan. Unless if you're a statistician, you probably wouldn't be able to do it alone. Definitely find a statistician and work with the statistician from the very start to come up with a detailed plan. The reason why we do a statistical analysis plan is very similar to why we do a research protocol. We want to be true and honest and transparent with how we're actually doing things. Because in statistics, there are lies, and there are lies in statistics. You can test anything. If you test it enough times, you'll find something just by chance. Having a structured statistical analysis plan means that this is what I'm actually doing, and I'm not just reporting things that I find by chance because it's interesting and it just, something that I've discovered. And there are some guidance on various types of statistical analysis plans, but I've just got a link there to one of them. Okay, so once you've got the detailed protocol ready, for those of you that work within WA Health, you can then submit it all for the ethical approval and whatnot. Actually, no, I take that back. As part of the protocol, part of the template within WA Health, they also have the project management side of things around personnel, budget, timelines, etc. So yeah, once you've got the theoretical bits done around the research design, the types of data you want to collect, the participants you want to recruit, how you want to recruit them, it's about thinking more broadly about the project. Who do you need to make sure the project gets done? When do you need the project to be completed? How much money or what sort of resources you need to get it all done? And also another thing to consider, which doesn't really get talked about enough, is project methodology. So there's lots of different lots of different project management methodologies that are out there. I'll quickly touch on a few of them. If you're really interested, you can find out more about them. There's lots and lots of resources about these three. Waterfall is sort of your typical project methodology where you have a Gantt chart of each key task or each key stage of a particular project and roughly when in the year you plan on getting them done. It could be granular to the week or to the month or to the quarter. Really, really visual, really easy to understand, but not very efficient because if one process gets held up, you're waiting, and the whole research project gets delayed. More recent and contemporary methodologies are something like Kanban and Scrum, which a lot of tech companies and startup companies use because it's quick and it keeps making things and it ensures continuous effort. So something like a Kanban board is a good way to visualize all your tasks. So in your backlog are all the to-dos that you need to do. Looking at your backlog, well, what do I need to do now? What do I need to do this week, this month, this year? And then from that, moving that over to what am I currently doing? And as you're completing a task or as you're progressing through the task, you're moving it through to, in progress, 50% done, ready for review, reviewed, completed. You can create as many sort of columns as you like. Realistically, I use a combination of both because the Kanban's great for getting things going on a day-to-day basis and a week-to-week basis, but I also want to make sure I haven't lost track of the bigger picture. So I use a bit of both. I use a bit of a Gantt chart to look at the overall project, and then day-to-day, week-to-week, I look at something more visual like a Kanban board to look at the actual tasks rather than the big stages of a project. So I talked about personnel. Forgot about project risk and evaluation and mitigation strategies. Don't plan an ideal project because it will never go to plan. Always think about what could go wrong in this project, how likely it's going to go wrong, and when it could go wrong. At what point, at what time point it could go wrong, and come up with a plan. You don't want to be in a situation where you're already behind the 8 ball and then something goes wrong and you're not in the frame of mind to think, how do I problem solve this ethically, appropriately, effectively? So when you're planning a project, always think about these things at the start so that when it actually happens, you've got a solution and it's a well thought out solution. As you're doing the actual research study and the overall project, continue to monitor it to make sure that you're progressing. So think about weekly meetings or fortnightly meetings or monthly meetings. What tech companies like to do is stand-up meetings. I've seen examples of planking meetings where you're physically planking while you're having a meeting. That keeps the meeting really short. But really, the main aim of these frequent meetings is just to really identify barriers early on rather than kind of waiting till months down the track and nothing's been done. So typically at stand-up meetings, it's what did you do last week, what roadblocks did you encounter, and what do you plan to do next? And that sort of normalises roadblocks. So after you've as you're doing the study, towards the end, you want to evaluate the study. So are you doing any sort of statistical or qualitative analysis? Like I said a little bit earlier, don't sort of leave it till the end. When you're doing, for example, statistical analysis, you want to have a statistical analysis plan at the start. And also you want to bring in a biostatistician or a statistician at the start if you're doing any sort of quantitative analysis. There is no use in having poorly collected data given to a statistician. They can work their magic, but it would be unethical and your findings won't be reliable. So garbage in equals garbage out. make sure that you consult someone with the expertise very, very early on to make sure that you're collecting data that's actually going to be usable. Not only should you evaluate the actual study and think about dissemination, you should really evaluate how well the project went, because that's how you learn, and then future projects will be more efficient, should be more timely, etc. All right. Towards the end, once you've got your, once you've analysed your data, it's about, well, how do I share this work? Remember that a research report or a research manuscript or a research conference presentation, it's all just a summary. You might have spent a whole year doing it, but it's about summarising the key points so that your message is heard for the people that you intend to hear it. So think about, for example, writing at least one manuscript or report. If you've got a lay audience that you want to reach, consider a lay summary and also consider a visual abstract, because our attention spans these days are getting shorter and shorter and shorter, so visual abstracts could be an attractive way to get your message across. So this is an example of one of my visual abstracts. I did not create this. We paid a graphic designer to do it. So if you've got a budget, which you have in your plan, you could pay them $1,000, or I think we paid about $800 to do something like that. Or you can do something more simply. One of my former PhD students created an animated GIF in PowerPoint. So she just made a bunch of slides in PowerPoint, and then when you save it, you can actually save it as an animated GIF, and then she shared that on Twitter, or X as it's called now, and that got a lot more views than her just giving a one-word summary or a tweet about our research. So yeah, consider ways to really attract your audience and think about channels that are relevant for them. And I think there will be a talk later this year about social media and research, so look out for that. That will give you a bit more ideas. So that was summarisation and kind of leading to dissemination. So thinking about peer-reviewed journals, I will be running a manuscript writing workshop later this year, so I'll be talking a little bit more about choosing a journal. But yeah, think about publishing in peer-reviewed journals, presenting at conferences, sharing things on social media. The beauty of social media is you have a lot more control compared to mass media, but it does require a lot more work. You have to build up your following and make sure that you share it widely to your following. You could contact media outlets. Just think about going back to that initial thing that I said. What is your why? Why are you doing research? Who is your audience? And making sure that they get the message that you want. Key tips, really it's about finding a team. When it comes to, for example, doing a PhD, you are the team, you are doing a lot of things yourself, but you also have supervisors, you also have researcher librarians, you may also have a statistician that could support you. So even in something like a PhD where it's meant to be one person, really it's a team. So for those of you that don't have a lot of research background but want to do research, surround yourself with or get to know people that have certain skill sets and try and assemble your team. The key things that you typically want is a research librarian, because they can help you find articles to make sure that your problem is a real problem and to help you understand your research context. To find an academic, people like me that do this for a living. Clinicians, if you're not a clinician but you want to do clinical research. Biostatistician, if you want to do anything quantitative analysis. Having a good science communicator, because you might be an excellent clinician and you might know a good academic that knows how to do research, but they may not be the best communicator. It could be that they could also be the science communicator, but make sure that someone can actually communicate the message clearly to your intended audience. Having someone to crack the whip as a project manager, etc. So make sure you've got a diverse team and an appropriate team for your intended purpose. And the last thing I want to leave you with is to ensure that your research can be replicated. So a lot of what I do these days is statistical analyses. I do a bunch of different types of research, but I do a lot of stats these days, partly because I'm also a statistician. But what I do is Gone are the days where I used to use, SPSS software and click buttons and generate research analyses. I do a lot more coding these days. And the reason why I do that, even though it's harder, is that it can be replicated. Because if I made an error in the code, if I publish that code along with my paper, other people can fact check my code and make sure that what I'm doing is, what I'm reporting is transparent and can be replicated. So you don't have to do it to that level, but make sure that whatever you do is well documented so that in theory someone else can replicate your work and get the same or very, very similar answer. Because if you just got it by fluke, that's not research, that's a fluke, and it shouldn't really be widely disseminated because it's not verified. All right, that's really it from me. Don't know, oh yeah, I did speak quite quickly. So lots and lots of time for questions. Happy to take the floor to our in-person audience, but also our online audience as well.
All righty, any questions around the room? Let people have a think. I just want to say I really liked how you started with the why and thinking about what your audience is. I think that's really important, who you're trying to get the information to, because it had that really well in at the end. And I also liked how you went through the reporting guidelines and you're thinking, this is how I'm going to report it, so how do I get that data in the beginning? I think that was really good. I was just thinking, when you're talking about exclusion criteria, how do you think through sort of what groups or areas you want to think through so that you're making sure you're getting the right subjects in your study?
It depends on the type of work. So if it's a clinical research project, definitely good to have clinicians on hand as well as researchers with that clinical expertise, not clinical expertise, researchers with that subject matter expertise. From a research perspective, it's about thinking about confounders. So, for example, if you do research on asthma, you will see studies where they exclude people with COPD, with uncontrolled allergies, etc., because those sort of things could reduce the effect that you're actually interested in. But you won't know what to exclude without that sort of background. So, it does depend on the area of work, but you need experts in the field to know clinically, for example, what sort of people do we want to exclude. They're going to throw out too many red herrings in the research data, and the data is going to be very, very noisy. And then also researchers that actually know, from a research perspective, what are the confounders that we need to account for. So yeah, hard to answer, but basically you need people with the right expertise to know, to go, okay, we need to include these people, we need to exclude these people. There's also the consideration around practicalities, not so much around inclusion-exclusion, but also which population can we access, and then by virtue of who we can access, that kind of guides, well, who are the people who we're actually excluding by doing that. Yeah. So there's a practical aspect as well as the research aspect and the clinical experience. Yeah.
I guess what take from that is, as mentioned at the end, it's all important to have a team around you. Yeah. It's important to have that team involved throughout the process as well. Any other questions?
So if you want to just experience like a small glimpse of research, that you're not too sure if you want to go full-time into research, what is the best place to start and where to start?
Yep. Okay. So if you want to kind of dip your toe into research and you don't necessarily have time or want to do it as a full-time thing, where do you start? So it depends on where you're working. If you're working in hospital and you're working clinically, it could be starting with a clinical audit. So a bit of background about me outside of research, I work as a pharmacist in a medical centre and we do a lot of audits. So it could be something as simple as, all right, we have the Shingrix vaccine, people that are immunocompromised, on certain doses of medications or have certain conditions would qualify for 2 free doses under the National Immunisation Program. Well, we can look at our clinical software and we can narrow down people with those conditions or with those medications, and then we can cross-check off whether they've had their shingles vaccine. If not, we'll call them up and we'll get them vaccinated. That's more of a practice sort of quality practice audit, but something sort of like that that gets you thinking, okay, is there a population that's untapped? Is there something about them that I want to know more about? So you could start with a clinical audit to sort of inspire where potential gaps are, and then you can cross-check that off actual published research. So start with something from your workplace that inspires you, and then if you don't have time, which most of us won't have time to do a thorough, systematic review, which takes months, you could use those tools that I talked about. So you could use something like Research Rabbit, or you can use even just a quick Google Scholar search just to find out more about that particular area. So start small, start with some background reading. If you've identified that it is a true gap that you really want to pursue more, well, find out from those papers you would have identified some potential researchers. Some people are open to cold calling, some people are not, but you won't know until you try. So it could be about reaching out to those researchers or looking at your local universities. So, you've got affiliations, I guess, here with UWA and some of the other unis. It's about reaching out to the researchers in a relevant field and asking to work with them. And as academics, I guess part of our KPIs is to do research. So typically people are open to collaboration, but it helps if you've got a clear question in mind to propose to them. Because if you don't know what you're doing and it's going to take you months to figure out what the actual research problem is, you're kind of wasting their time as well. So do some background reading initially. If you think, yes, this is really something that I'm interested in, something that is a real problem that needs solving, once you get to that point, reach out to someone.
Anybody else? Fantastic. Thank you so much for your time. It's been brilliant. I think I might have a slide at the end for talking about where to next. Fantastic.
I'll leave it to you. Yeah.
So that's the survey link there. So this year, so those who've been here in previous years, we run this basically on a fortnightly basis on a Friday. But to allow people, you're going to take a day off a week, it's going to be the Friday, isn't it? So to allow people that are working part-time or people that aren't here on a Friday, we're going to alternate with Tuesday afternoons as well, around the same time, same venue. So the next presentation's in 10 days' time on the 17th of February. That'll be looking at consumer and community involvement in research, and that's really important nowadays. Most studies that you want to try to get through an ethics process are going to need involvement from consumers to make sure that what you're designing, as we're talking about the team here, we're talking about what's relevant or how everybody else thinks, but also getting the input of a parent or a patient. What's actually relevant to me? What do I think the research needs to look like? So, so that's going to be in, as I said, Tuesday week, and then we got going through ethics processes for clinical research. That's in 3 weeks' time on a Friday. That is it. Thank you very much for your time.